welcome everyone. I want to do two things here in introducing Dr. Galichia. First of all, I want to give him a little gift. We have been working here at the clinic for 35 years. Many of you may know that we are a nonprofit organization that was founded through the efforts of Olive W. Garvey and Hugh Riordan, working on research, education, health education, and innovative clinical services. And so in that spirit, every year we promote investigative research into new areas. And one of the areas that we've been looking into is endothelial progenitor cells. These are adult stem cells that actually help repair damaged lining of blood vessels. So I thought it would be very appropriate to present to Dr. Galichia our latest research summary of the work that we've been doing in this area. So Dr. Galichia, this is just a small thing from us. Yeah, thank you. And then I want to welcome Dr. Galichia, and I actually want to tell a little story in introducing him. He and I go back quite a ways, and when I first started in Salina back in 1987, I can't even remember. Probably that's not that long ago, huh? Anyway, the Galichia group came up and helped us with cardiology care. And one of the things that we did there that was, I thought, very innovative at the time and actually led me into this field of health and nutrition and wellness was that we started a wellness program. It was one of the first family practice-based wellness programs, and it was called WellPlan, and it involved exercise physiology, nutrition, counseling, and stress management. And it was really a very nice little program. It was so nice that Dr. Galichia came up and bought the program. And so I think the plan was to bring it here to Wichita, and I think something intervened, like maybe a heart hospital or something like that. I don't know. But I don't know what would have been more important than WellPlan. But I was going to ask Dr. Galichia in the course of his presentation if he would tell us a little bit about his work in the area of health and wellness, because he is really one of the true pioneers in wellness in the state of Kansas, not only in terms of serving Kansas as far as interventional cardiology goes, but in terms of educating the public as to the importance of learning how to take better care of yourself with nutrition and lifestyle. So we are very honored today to have Dr. Jody Galichia speak to us about achieving a healthy lifestyle. So welcome.
Okay. Let me try this and see how it goes. Hey, thank you so much, Ron. We do go back a long way, and I have always admired what Ron does. I mean, unbelievable. I think the efforts that we all make in prevention are so important. You know, what we do for ourselves is so important. So I'm happy to be here, and thanks, Ron, for having me. You were talking about WellPlan. What we did was we just tried to take those same concepts and incorporate them into the rest of what we do. So I think WellPlan was absolutely on the cutting edge at the time, and I think what's being done here is also on the cutting edge and stays that way. So kudos to you, Ron, for everything. Today what I want to talk about is achieving a healthy lifestyle. You know, and I think it kind of comes down to a couple of simple concepts. Everybody that I run into wants to stay alive well as you can be for as long as you can be. Now, you know, maybe there's some feeling against that. I don't know. But every time I look at a patient, I always say the most important person in the world is the one right in front of me, and that's you, if you are the patient. And one of the talks that I try to have with people is, what do you want? What are some of your goals in life? You know, and sometimes people will say, well, you know, I don't care if I live to be 80 or 90. I just want to live well. And sometimes people will say, you know, I'm not worried about all this diet and exercise stuff. I want to smoke, I want to drink, I want to have a great time, and que sera. So it's when it's over, it's over. And I say, you know, that may sound okay, but a lot of times it ain't over when you think it's over. You know, you have a big heart attack, but lo and behold, you survive that. or you have a stroke, and then now you're sitting in a nursing home, so it wasn't over. You know, you didn't die, but you're in a bad spot. You know, nobody wants, well, I don't want to be there. You know, so nobody wants to be there. And the death wish kind of goes away for my patients when the moment of truth is there. And I can just share that with you. I'll find people that have just, they're older and nothing is right in their life, and they say, but I don't want to die. You know, it's something that God gave us that, you know, it's a light that burns in us. It says we want to stay alive as long as we can. So if that's the game plan, then we have to do some participation in that. You know, we have to take charge of things. Now, here's some things that I just want to share with you that sometimes people will say, well, I know I'm okay because my cholesterol is only 210. And I go, okay, that's not so bad, but what we're trying to do is we have to know some more stuff. We need to know if your good cholesterol is okay, is it high enough, is your bad cholesterol going to get you in trouble. And as Ron would tell you, there are other ways we can evaluate cholesterol now. You know, we can look at particle size. We can do a lot of analyses so that total number doesn't just put us in a good spot necessarily. We have to know what the components of it are. So that's one thing. The second thing is, a lot of times people will say, well, you know, I know I'm not having a heart attack because it doesn't feel so bad. I mean, I think there's something wrong, but I'm not sure. And here's one of the mistakes that people make. They think if I'm not having this classic heart attack where there's an elephant sitting on me and I'm sweating to death, you know, and I can't move anymore, then it must not be a heart attack. So people will delay treatment for a heart attack because they try to pawn it off onto something else. So who do you think does that the worst? Men. Men are like, well, you know, I thought I was having a heart attack, so then I decided to go out and take a run. And then if I was okay, I was okay. I'm like, now that is not too smart, you know. And women never do stuff like that. I mean, women are much more responsive to their bodies. They really are. There's some macho thing in all of us guys that makes us want to, like, go to work, provide for the family, be tough, you know, go get back into the game, get your helmet on, and go and do it again. But, you know, we need to learn a lesson from our wives and our women that we got to respond a little better. So for men, I think you got to know the warning signs and don't wait for the elephant because it might be the last elephant you ever see. With women, unfortunately, the symptoms are often way different from men. And you know that now probably from television. We talk about it a lot on TV and radio, that women often have sweating or weakness or nausea or something when they have a heart problem, if they're having a heart attack. It's not always a classic symptom. But here's what I've learned through the years. For men, it's not always a classic symptom either. You know, men often have the same thing that women have. The American Heart Association now has come out with all this advice about women and heart disease. And I love that because women get neglected in the whole equation. Doctors say, well, you know, you're a woman, so you're okay. Wrong. I mean, more women now die of heart attacks than men. So, you know, just being a woman gives you no protection whatsoever. They just die later in life of heart disease than men. So we got to understand that. So all the diet and exercise stuff that I talk about for men is just as important for women. Estrogen may protect you for a while in life, but later on it doesn't. Another thing that happens is we see a lot of patients who come in and they say, well, I only have a 40% blockage, so I'm fine. Now, we used to think that was true, but now we know that a lot of times these smaller blockages are more vulnerable to plaque rupture and actually causing heart attacks than some of the tighter ones. And I'm going to show you some pictures later of that. So just a concept you got to keep in mind, that once you develop coronary disease, the kind of stuff in the wall of the arteries that Ron's working on here, once that process begins, then it usually is inexorable. It just goes on and on. So what we're trying to do with all the strategies we have is try to slow it down. Now the great thing is that if you don't get it in the first place. And furthermore, we have a lot of imaging technology now that enables us to look at that plaque and see how vulnerable it is to causing a heart attack. You know, and we can actually look inside the arteries with the echo machine now, which I do every day in our lab, to assess what these plaques look like and whether they're dangerous or not. So that is a total new concept. It's not any longer, well, you got a 90% blockage, so you're going to have to get something done. Sometimes these lesser lesions can be just as important. So once we find a problem, we want to jump in there with diet and exercise and medication and strategies. We want to come up with a game plan that arrests the problem, slows it down. Most of the time, we can't very effectively reverse it. I'll talk about that later too. So the integrated approach is the right one. Sometimes we may put a stent in an artery that isn't so tightly narrowed if it looks like it's about ready to rupture and cause a heart attack. So that is a new concept that we'll be talking a lot more about on radio, TV. You'll be reading a lot more about that in USA Today, Wall Street Journal, and Fox News, CNN, all the stuff that you read and watch. We'll have more about that. So everything is important here. There's not one phase of that strategy that we'd say, it's not so important. Exercise, for example, is very important. Here's some things I want to mention. If it's I'll get some exercise a couple days a week, or, I take out trash. I'm like, what? That's your exercise? Wow. I didn't get it. Or people will say, well, I work in the garden. Okay, when? Well, I put some flowers in the spring, and I go pick them, and I weed, and I'm like, man, that's not much. What do you do in the winter? Well, wait for spring. So it just, you can't do it that way. And the one thing I really applaud all of you for is you're interested in this, in all this stuff, enough to come here. And I really think that's a great step. But what we tell people today is you need to exercise 45 minutes, 5 days a week. That's what I tell my patients. Now, the reason is that most people can't find 7 days a week. And I'm pretty religious about this. Boy, I'm telling you, I want to work out every day. But, I'm traveling here, I'm taking a trip to Europe or someplace, and what do you do? You're sitting on an airplane. Maybe I run around the airport with my little girl or something. But, it's just still that devoted time needs to be there. A recent study came out that was actually done by the National Institutes of Health, and it showed that we all ought to get 1 hour of a pretty brisk walking in a day. But here's something incredible. If you're a woman, age 50, and you weigh a certain amount, you have to walk that much every day just to maintain your weight. So if you think you're going to lose weight by exercising, you got to do something dramatic. So it's not the only thing that you can do. It's very, very important. And the other thing is, if you're just walking along, and sort of idly exercising, that doesn't do you much good. It's better than nothing. But you need to do it with gusto. That's what I tell my patients. Walk fast. Walk that walk if you can. Or bike, kick it up a notch. And just slow moving around. Sometimes I've got a woman who runs in my neighborhood, and I swear, I think she's going backwards. She just kind of runs around. I see her, she runs every day. I'm like, oh my gosh. Maybe that's all she can do, but if she thinks she's really, achieving what she needs to be achieving, it's just too slow. You gotta push it a little bit. Bad weather, that's the biggest thing. Patients come in and I'll say, well, how are you doing with your exercise program? Well, it's been really hot. I go, okay, well, it's June, it's hot. So then I'll see them maybe 4 months later, and I'll say, how are you doing with your exercise program? Well, we had some bad weather, and I'm like, okay, take the weather out of the equation. Find something you can do that's not weather related, because the weather is the best excuse in the world. I'm telling you. If it's a great day, people will say, wow, it's really beautiful, but, I got to run an errand. So, it's just like, don't do that. Go walking in a shopping center, or ride a bike, or indoor swimming, something. Bad weather is the best excuse I know of. And great exercise is walking, and walking. But it's really doing what you want to do, what you like to do. And a lot of patients will come and they'll say, I don't like to do anything. You know what? If I'm being honest with you, I like to sit and watch TV. So I'm saying, okay, that's not going to work. So you're going to have to do something. And why don't we search around a bit? And, you know, it's like that is a tough spot to be in. You know, and if you hate riding a stationary bike, I got to tell you something. Don't buy one. Don't buy it. I have more patients with dust-laden stationary bikes sitting somewhere in their house, and they go, well, I bought it, but I never use that thing. You know, so it's just a waste of money if you don't really feel good about it. Try something else. And the other thing is that in everyone's wellness program, this is the least expensive thing of all. You know, you can always move around somehow. And even in your home, you can walk around. You really can. You know, you can walk around. You can walk a lot. In this room, I'll tell you what, I could get a great workout right here. I could get a great workout in this little hallway here. You know, if I were forced into that. Sometimes I'm traveling around and in hotel rooms, I will do a great workout. You just, you know, even if the gym's closed. And if you like gyms, go there. I think gyms are wonderful because you got other people to work out with. You know, yoga, aerobics, all these things are great. Couple things, lift some weights. And what I tell people about that is if you walk, we want you to walk with gusto or bike with gusto, but don't lift like Arnold Schwarzenegger. There's no value in a great big, strong, muscular, overweight individual in today's world. And actually, heavy lifting puts you at risk. It raises your blood pressure too much. It stresses your joints. But you ought to lift a little bit. Now, my mom is 92, and she says, every day I lift this can of corn 5 times. I'm like, great, Mom. Keep it up. You know, that's a good thing. But you need to have a little bit of resistance training in your program. And it doesn't have to be fancy. You don't have to go out and spend $100 on weights. Just simple little things, you know. A pitcher of water weighs a certain amount. Stretching is important. You know, beware of TV ads. Boy, oh boy. I mean, late night television or any time during the day, you can see 1,000 different items on there, right? And it's going to make you have, you know, great abs or, you know, it'll make your pecs look better, you know. And I'm like, okay, most of my patients don't need that, you know. And furthermore, these things just fall right by the wayside. I tell you, if you saw one of those devices advertised 3 years ago, do you ever see it now? No. There's a new one that took its place. So people will waste money on stuff like that. And I'm going, don't do that. You know, I mean, I'm sorry. If you really, really want to do it and you really want those great abs and great pecs, well, okay, you know, that's your goal. But you got to be careful with them. And there's no magic trick out there. Now, one more concept for you. If you're trying to lose weight, what I tell everybody is you can't run it off. You know, if you want to lose weight, you have to eat less because it's been shown that these exercise programs, I tell you, unless you go in there and take the Nestea plunge and you're going to work out an hour a day really hard and just push it to the limit, you can't lose weight by exercising. Exercising has tremendous value, but it ain't the way to get the pounds off. So whatever those ads tell you, they're usually wrong, and people get very disappointed about that. They'll say, you know, I walk a mile a day now, I'm gaining weight. Makes me hungry, I come back, and I have a snack. I'm like, okay, yeah. I mean, you know how much calories you burn walking 1 mile? It's a small amount, maybe 100. Sometimes I'll go down, here's what happens to me sometimes. I work out in the evenings late because I don't have, in the morning my days start pretty early and I have to go and do surgeries and stuff like that. So I come back in the summer, I swim with my little girl, my wife, and we hang around and, you know, we have a little bit of a later, lighter dinner and try to do it that way. And a lot of times I'll ride an exercise bike at night. But here's what, I can work out on that bike for 45 minutes and burn up 500 calories. And if I come upstairs and eat one cookie, I go, oh my God, I wasted the whole time. You know, a 300-calorie cookie and a glass of wine. I mean, if I do that, I might as, you know, it's a trade-off. I just killed the whole workout time. So you have to do you have to be like cross-country skiing, do something incredible like that to really burn up a significant amount of calories. So it all comes down to diet. It comes down to your nutrition. And here are some things. You know, and I want Ron's thoughts at the end about this because everybody's got some ideas about dieting. Fad diets don't work. That's a concept you got to understand. You know, if it's a great thing and everybody's doing it, I mean, how many diets have you heard about in your lifetime? 1,000. And I'll see patients and they'll go, oh, boy, I'm doing a great deal. I'm on that cookie diet. I'm like, oh, the cookie diet. You know, the cookie diet. And what do you like about it? Well, I can eat cookies. Did you lose weight? Oh, I'm full all the time. I don't want to eat anything else. But, I mean, you know, there's calories in that. So you just can't, you got to watch it. The number one concept is if we all ate less, we'd all weigh less. It's just a simple equation. That's, you know, as clearly as one could state it. You know, if we ate every meal about the quantity of our fist on the plate, no matter what it was, we'd probably do okay. An example of the French. The French eat some of the craziest stuff, you know. They eat stuff with cream, a lot of cream sauces and everything. The French are much thinner than we are. I always say there are two reasons. And we spend quite a bit of time in France, at least a week or so in the summer. And so I watch them a lot, you know, because they're smaller than we are. I can tell you that. But they don't eat big meals. They do not. And none of their restaurants are judged by the quantity of the food. Nobody says, oh, you got to go down there, you know, you can get a 20-pound steak. I mean, no. They're talking about quality, you know, quality. What's good and what tastes good. And you go into a French restaurant, a lot of times you come out a little bit hungry, you know, because things are not big proportions. So I think, you know, we need to emulate that a little bit. American restaurants, I swear, did you ever see a good restaurant that says, come here, it's going to cost $30 for your dinner, but we're just going to give you a little bit? I mean, like, no. A group out of Boston, out of Harvard, a couple years ago, did a study, French restaurants versus ours. The size of the meals in the U.S. was like 3 times bigger, 4 times bigger than what you would get in a French restaurant. Costs about the same, so we are a bargain. I mean, if we were all feedlot animals, I got to tell you, I mean, somebody is making money on us because you get a whole bunch of food. And you get a whole bunch of fat, and you get a whole bunch of calories. You know, that's a good American restaurant. And in the Midwest, it might even be worse than it is in Boston, but I don't think so. Now, one of the better diets, the other thing is, a lot of diets are structured in a way that you can't live with it. You know, people will say, oh, I'm on that diet, I'm doing great. 3 months later, you see them, and they say, you know, I got so sick of that, I can't do it anymore. So now I'm back to eating pancakes and Hearty Man breakfasts and steaks and, you know, life goes on. So that's part of the problem. But research would tell us that maybe the best diet is a diet that's kind of like people eat in the Mediterranean countries. And it's kind of historically been sort of a poor man's diet, actually. Not a lot of meat, and I'll go over it with you, but a Mediterranean type of diet. And then another diet I want to talk about is a high-protein diet. So you kind of got 2 ways to go here, and there's some advantages. But the most livable diet for most of us would be a Mediterranean diet, in my opinion. And here's what. It's a diet that has some meats and sweets, but not much, but poultry and eggs. But largely, it is a diet that's centered around fruits and vegetables and whole grains, and not a lot of beef, not a lot of pork. You know, this is a diet that's very skinny on those things. And, you know, if you look at that, it says meats and sweets not very often, but fruit and vegetables 10 times a day or more, and whole grains and stuff like hummus and olive oil, and those kinds of things that have kind of crept in, actually, to our diet here in Wichita, I think, because we have so many Lebanese restaurants. But that kind of food, if you could live with it, is really healthful. And actually, people who live in those areas have a low rate of cardiovascular illness compared to us. A few years ago, I was doing some talks in Greece, and I had this driver. And he was a philosopher. I swear, all these drivers are philosophers. And, you know, when you're out there on a tour doing a bunch of talks, you get some time to just hang out with these guys. And he told me one day, he says, nobody in my family has ever had a heart attack. Nobody. and we're all a little bit heavier than we should be. I said, okay, I could buy that. And he said that in his household, it was him and his wife and 2 kids. They used 32 liters of olive oil a year. And they're cooking and just, and sure enough, I mean, this guy, if we stopped in a restaurant, he never would use butter, ever. He would dip something in olive oil. He never used salt. He used spices, and so I thought, hey, this is pretty good, not bad. But those are some of the ways that I think we can do a better job. Fish and poultry go really well. If we fry it, well then, we've taken the value right out of that effort, no doubt about it. So I think that the Mediterranean diet is one that we ought to look into and get our arms around, because I think there's a great value in it. Now, there are different variations of these diets, but largely many servings of fruit and vegetables and less meat and not many sweets. And what I tell people is leave the sugar out. Candies and anything that's white, basically. Just leave it out. White flour, processed sugars, all these things are bad for us in general. Now, if you say, well, I don't want to read the book, I just kind of want to just do something that's good that I can live with, here's some simple approaches that you could take. Stick to veggies, fruits, and whole grains. And that's not so difficult to do. Go nuts, meaning nuts really are helpful and very, very nutritious. And I think we don't eat enough nuts in our diet. And believe it, even peanuts are on that list. So, you can't just live on peanuts. But peanuts are very nutritious. And peanuts that are unsalted are better for us than things that are salted. Pass on the butter. And, if you go into a restaurant, what's the very first thing they always do? They serve you bread and butter. And, I remember in the past, I would sit down and have a piece of bread and put butter on it before I even got started with the menu. It's like, oh boy, we're starving. Here we are. And I think that's when it takes a little bit of discipline. Just put that aside. And then, it'd be nice if you had whole wheat bread and some olive oil to dip it in. That might be a better approach. But that is not what we see commonly here. And it's probably not what we do in our home. And I can tell you, I grew up in southeast Kansas on a farm, and that wasn't what we did in my home when I grew up. So, we had bread and butter and homemade bread and cinnamon rolls and all the really great things that I still love but try not to eat every day. So I think we need to change that. And another thing is spice it up. Instead of using salt on everything, try to use something else. There are other spices that we can put on food. And pepper goes a long way, actually. And we don't have much evidence that pepper is really bad for you. But we all consume way too much salt. And we salt everything, and a lot of times ahead of even the dinner. The food comes, put the salt on, and then start eating. And not even check it out. And, we see this in the hospital, actually, a lot. Right now, we have one of the things that people love about our hospital is that the food is good. But you know what? One of the reasons is that we try to get some spice in the food and make it taste so that it tastes better. The thing that's missing in hospital food usually is salt. People say, well, those potatoes taste like cardboard. Yeah, there's only one thing that they didn't put in there was salt. And the reason is that salt is not good for most patients. And people with heart failure and kidney failure and everything, the last thing you want to do is give them a big bunch of salt. So the hospitals are trying to do the right thing nutritiously in terms of someone's nutrition, but it just tastes awful, and so we've really tried to work on that. And in fact, now we have people that'll say, I'll say, do you want to go home about 10 o'clock in the morning? And I'll say, well, I think I'll wait till after lunch. I'm like, okay, that's good. That makes me feel really good because I know that we've conquered something there, at least partially. And sometimes you just can't do it. You just have to say, look, I'm going to give you this austere diet, and that's it. I'm sorry, I can't do it differently. But usually, if we search around, We don't have to do these austere things. We can make something that really tastes good that's still good for you. And we do have that experience. Another thing that I always say is go fish. I mean, you know, eat the fish, even above poultry, and certainly above pork and above beef. And, you know, there are some fairly lean cuts of meat that you can eat and get by with it once in a while. But if you just, I think there's a great value in eating fish at least 3 to 5 times a week. And there are tons of studies now that would show that those individuals who eat fish 3 times a week have less heart disease and vascular disease than people who eat no fish at all. Now, if you go somewhere where they fry the fish, you know, that's not going to work. You know, I'm talking about salmon and bass and trout that you can eat that is not fried. I think that those places that we have here in town, not to name any of those restaurants, but the ones that fry fish, oh my gosh, did you ever see how many calories were in an order of fried fish at a fast food restaurant? It's more than you get from a Big Mac. No joke. You know, it's like 1,100 calories for fried fish dinner at one of those places. You know, and with a beef hamburger, probably 400 or 500, and then of course you can just, you know, kick it up from there. So rein in the red meat, and if you're going to have dairy products, there are a lot of low-fat strategies out there. 0% milk, I think, is the only milk that we should consume. Low-fat cheeses are available. And even ice cream with 1 or 2%, I mean, it's better. You can't eat ice cream every day. But if you're going to consume ice cream and you really love it, you can shop around and find the one with the least amount of fat and the least amount of calories. And then, you know, use some judgment on that as well in terms of the quantity. Okay, here's a question that comes up every time. We get this question on the radio show, I bet, once a month. Is it okay to drink red wine, and how much? And it's either somebody who wants to start drinking, or somebody whose wife is telling him, you drink too much, or somebody who's just exploring a little bit. So I'm going to give you some perspectives here. I think red wine in a small quantity is beneficial. I really do. And by a small quantity, I mean no more than 1.5 glasses a day. Now, you know, I talked about the French, and the French do have less heart disease than we do as well, despite smoking more than we do, and you know, the way they eat is not always stellar. But they do consume about 2.5 glasses of red wine a day. And I'm like, God, you go to a restaurant and drink 2 glasses of wine, you're drunk. You know, you can't do that. So I tell patients, you just can't go driving around after you've had 2 glasses of wine. You know, that's too much. 1 glass of wine you can probably get by with. So I think it takes some judgment here. Now, here's an interesting thing. If you're an adult and you've never had the privilege of drinking red wine, and you say, okay, now I'm going to drink this stuff, a lot of people say it's worse than medicine. You know, like, there's no medicine that tastes as bad as this. I'll tell you a funny story. A few years ago, I saw this guy in my office, and he was a good friend of mine from the past. I hadn't seen him for 20 years. He was a radiologist in Tulsa, and I knew him a long time ago. Great guy. So he said, you know, my brother had a heart attack, and I want to make sure I don't have a heart attack. So he came up to see me, and he knew me, and he said, I want to see you, no one else. So we talked a little bit, and fortunately, his arteries looked pretty good. He had a little bit of plaque. And he says, okay, now what can I do to not die like my brother did? I said, okay, let's do this. So here's a diet. You know, I put him on actually a cholesterol-lowering drug. And I told him, I said, you ought to drink 1 glass of red wine a day. He goes, man, I never had that stuff before. So he said, what should I drink? And I said, well, you know, don't go out and buy a $100 bottle of wine. You know, just. So I gave him a list, and I told him of a liquor store where he could go, where I knew the proprietor, and he would try to help him a little bit, you know, with some cheaper wines that were good and maybe break him in. So one day, about 2 weeks later, he calls me back and he says, I'm coming up to Wichita and bringing all this wine back. I said, why is that? He says, it's sour. He said, it's all ruined. He said, it just tastes awful. And I said, well, yeah, I'm understood. You know, he never had drunk wine before, and he was trying to drink this red wine, and he was trying to drink a whole glass in about 5 minutes. So we had a problem with that. But the funny thing was, he gave up on that. He says, this stuff is so bad, you know, I don't want to try it. I mean, I hate it. So, you know, it's not like everybody wants to drink red wine. Another thing that happens is people who have a religious belief against any alcohol consumption will argue that this is going to lead you to all kinds of debauchery, you know, drunkenness, slavenness, adultery. You know, I'm like, okay, you know, one glass of red wine, I don't think that's going to happen unless you want it to. But the interesting thing is that almost all alcohol has some cardioprotection about it. And one of the things we noticed back in the VA hospital when I was a resident was that the hardcore alkies didn't have as much heart disease as the rest of the people. You know, and believe me, that was the case, you know. And yet we find that people who drink a lot often do have heart disease. But, you know, I'll have people come in and they'll say, well, you know, I hate that red wine, but I sure like beer. And is that as good? And the answer is, we don't think so. You know, no good evidence of that. And a lot of times I'll say, well, how much beer do you drink? And a guy will say, well, not much, a little bit. And I go, how much? And they'll say, well, like maybe a 6-pack during the week. Like the whole week? Nah, every night. And I'm saying, no, that, in my opinion, that's a lot of beer. And then, how much on the weekends? Oh, maybe a case. I'm like, I mean, for the whole weekend? And the wife will go, no, every day. And, you know, that's not a value, I can tell you right now. You will kill yourself if you drink too much. So there's a fine line there. I mean, people who are alcoholics have high blood pressure, strokes, you name it, you know. And then the other thing is that in the name of good health, you can't go to a restaurant, have 3 glasses of wine, and drive out and get a DUI. I mean, there is another risk, or hurt somebody. You know, so all of it takes a little bit of judgment. And I have a gentleman in my practice who is a great friend of mine. He's an awesome guy. And he tells all of his patients, don't you ever drink 1 drop of alcohol. I think it's wrong, it's morally wrong, and don't do it. I don't care what Jody says or the rest of the world says, just that's a bad deal. And there's always a fear, you know, that 1 drop of alcohol will lead to chronic alcoholism, and, you know, that person will abandon his family and wind up in God knows what. And, you know, I respect that too, because for every alcoholic out there, they had to take their first drink. So you have to put all that into perspective. But it is so funny how people will do that. You know, they'll say, well, I don't like that wine, but that whiskey is a lot better for you. And I'm like, no, it isn't. And no evidence for that. Here's another diet that I kind of like. And, you know, it's just a concept that you need to understand. And that is the South Beach diet. And it's a diet that gives you a little bit more ability to eat lean meats and fish and eggs. But it again, stresses nuts. And it's a diet that's more oriented towards high protein, low carbohydrate. So if you ever see that diet somewhere, it's a diet that I find more people can stay on than the predecessor of this diet that was very popular called the Atkins diet. And the Atkins diet was like, you can eat all the steaks and eggs you want, but no bread and, you know, no white things. So it's a little bit the same, but I hate to see people just consuming a lot of red meat and high-fat content items because of the cholesterol changes, you know, things that it can do to your body otherwise. The interesting thing, there was a head-on study done not too long ago, and it compared the Mediterranean diet with the Atkins diet. And believe it or not, the Atkins diet, although it allowed you to eat all this meat and, you know, stuff that we ordinarily would say don't eat that, those people's numbers, their cholesterol levels and their sugar levels weren't so different from the people who were on the Mediterranean diet. But I think that you kind of have to do one or the other. And one of the things that we can't do is just continue eating a high carbohydrate diet forever. I really think there's a risk in that. Like I said, most fads don't work. a healthy lifestyle and a healthy way of eating is so important. And if you have to choose between one or the other, the most important thing is what you eat. And I do believe that. We had a gentleman on the radio show with me a couple of months ago, and he was a surgeon who has been to a what do I want to call it? He calls a fat farm, but he's joking about that. But 3 times in his life, he's gone to Duke University for 2 months to try to lose weight. And every time he loses about 100 pounds. And it costs him about $20,000. And he comes home and he walks, and I see him walking around town, and he's like, he's very much spirited about this whole deal. And then I see him 6 months later, and he's back, he's gained 100 pounds. And I'm like, gosh, what are you going to do? And he is willing to talk about how difficult this is for him. And along the way, and he's a 50-year-old, 55-year-old surgeon. Along the way, I've had to put stents in him. I've got him on every cholesterol-lowering drug known to man. He's developed diabetes. All the metabolic consequences of a bad diet he has experienced in his lifetime. And he has made a valiant effort to lose weight. And he says, everybody in my family was heavy, and, I don't know what to do. Every time I just relax a little bit, I gain it all back. And his wife is a woman who has never gained or lost 1 pound in 30 years. And let me tell you about that. You talk about the value of exercise, and I don't want to just diminish that in any way. But his wife had multiple sclerosis, and she was bound, bedridden for 30 years and passed away this past year. And by titrating her diet, she never gained or lost more than 1 pound. And her husband, who was trying all his life to lose weight, could never keep off that extra 150 pounds. And he was doing all these things. So the difference was that she was in a controlled environment and had a controlled diet. And, he would do well for a while, and then he goes out and, goes on a vacation and, goes to a medical meeting somewhere and starts eating steaks again, and then he's back at it, and he does it all over again. So, and part of it, I think, is hereditary in a way that we can't explain completely. That some of us are going to be heavier than others, and it's going to be a problem forever. So I think that it's very, very, very important what we eat and what we understand. There's some other things I think that go to a healthy lifestyle I want to talk about just for a minute before I take your questions. And one is that happiness goes a long way. And positive energy goes a long way in preventing disease. I think people who are angry and upset tend to get sick quicker in life. They age more quickly. And, if you talk about quality of life, well, if you're upset all the time or your glass is always half empty, no matter how healthy you are, you may be your quality of life is diminished. So I think that is really important. Depression and understanding it and recognizing it and treating it and getting counseling and possibly medication is very important. And now there's been a lot of studies that have shown that people who have heart disease have a higher level of depression than others. It's not always that way, but it often is. So I think we have to find time and ways in our life to have fun. And everybody tends to leave that out too much. I've never seen anybody who was dying who said, well, I had so much fun in life. I wish I had too much fun. Never see that. You see people talking about things like, whatever I achieved wasn't as important as the time I spent with my kids or my parents or in my church or doing good things for other people. That is just something that I think runs true across the board. I have a friend in Italy who is an interesting character. A couple of years, 4 or 5 years ago, he took 1 year out of his life to go out and pursue what he calls quality of life. And, he spent some time, it's kind of like that movie, Eat, Love, Pray. Eat, Pray, Love. Yeah, he did the same thing. He just went around to different places trying to get his happiness together. The other parts of his life he had put together well. You know, his weight was good, his nutrition was good, he was exercising every day, but he was unhappy. He just wasn't happy. And so talking with him through the years about what he has done, about quality of life, you know, he didn't find the Holy Grail. He didn't find the girl in India. You know, none of that happened to him. But he has gradually become a happier person, I think, because of the effort that he's made to understand himself. And I really applaud that. Intellectual growth, I think, is incredibly important. You know, one of the things that I recommend is that if you can work a little longer in your life, work a little longer in your life. Some of the most unhappy people that I see are people who quit early. I mean, I have a guy that I see in my practice who is so proud of the fact that he retired at age 50. And now he's about 60. And I've watched him go like that in every way, intellectually, physically. You know, I say, well, what are you doing now? Oh, I'm busy. You know, I'm really busy. Well, tell me about it. And then I find out, you know, during the day he doesn't do anything. And he doesn't have much purpose. And I thought he was a lot happier when he worked. And the thing that's important to him, though, is that he was able to retire. He was wealthy enough to retire. And I've said, well, what have you got now? You know, you're still wealthy and you retired. That's great. But what are you doing? And, you know, we have that discussion. And, you know, I think that it's a bit of a tragedy, really, that, you know, he's never found another thing to occupy his life. So my personal goal for me is to just work until I can't work anymore. I mean, I absolutely love that. And if you are retired and you got away from that job, find some other things that you have a passion for. You know, I have a lot of patients who quit working and now they're on the internet 4 hours a day, you know, exploring the world around them. What a wonderful thing. But intellectual growth and the contact with the world that we live in is very important. Spiritual fulfillment, yes. Keeping in touch with family and friends and hobbies and things that you like to do. You know, one of the things that I do is ski. And a lot of the guys that I used to ski with have quit skiing. And I go, well, why'd you quit? I think I'm too old for that. And I'm like, no. You know, if you keep yourself fit, you can do that forever. It's just one example of what you can do. Aside from that, I think some other things are very important for us as individuals. We need to keep track of our blood pressure. The older we get, the higher the tendency towards having high blood pressure. About 1 in 3 to 1 in 4 Americans now has high blood pressure, adult Americans. Think about that. This is something we can treat. But if you haven't had a check for 2 years, well, you know, you may go 2 years with a too high blood pressure. So that's a number we got to know. Cholesterol, we talked about. You need to understand that and discuss it with your doctor and see what you can do to make it better, including medication. The thyroid needs to be checked, the PSA level. Colonoscopy should be done in patients. Mammograms. You know, somebody needs to listen to your heart. And when your doctor examines you, check him out a little bit. See how good he is. See if he listens to this artery in the neck. You know, I have patients that come in and have a loud sound in their neck and a 90% blockage there that have a every 3-month physical exam. And I'll say, did anybody ever listen there? No. You know, in fact, a lot of times patients will come in and they'll say, I see my doctor every 4 months. Does he listen to you? I don't think he's listened to me for a long time. You know, I mean, listen to your heart and lungs. And it's just kind of a little thing that sometimes people fall into. They look at you and go, oh, you look pretty good, your blood pressure's okay, adios. You know, but you want a physician who is very, very attuned to you and your health and your body. And you can't do that by just walking in the door and looking at somebody. You've got to check them out. Yeah, there's one more thing that I think could change the world, and we haven't seen it yet. And that is technology. We now, you know, the biggest killer in America is cardiovascular disease. We do not have a national initiative in this country to make an early diagnosis. And Ron may disagree with me, but we don't. We talk about prevention, but, you know, if it's cancer, oh, you want to find out right now, right? That's why you do the mammogram or the chest film. With heart disease, No. Nobody is saying everybody needs to get a treadmill every year or everybody needs to get a heart cath or whatever. And one of the reasons for that has been that these are expensive tests and they often give you a little bit misleading information. But now we have a tool where you can make a picture of your artery in less than 1 second. You can look at the arteries, you can look at the calcium in the arteries, and you can do it with low-dose radiation and with the cost of about $150, about as much as it takes to get a 10,000-mile checkup on your car. And that technology is just an infant today. We have it, and you probably have seen that. But I've made a statement on many times recently that if every one of us could have a test like that and then have whatever needed to be treated, either with medicines or nutrition and all the things we have, a stent or whatever it takes, that we could extend the life expectancy of the American people about 6 years, maybe 7. And we could decrease the rate of heart attacks about 50%. Think of that. The technology is there, but nobody's talking about it. You know why? It is expensive. I mean, the test isn't expensive. The test is cheap, and it's very reliable. I wouldn't have said that a year ago. We had a similar product, a similar thing, but it didn't have the definition that we have, and it was too high a dose of radiation, so you just couldn't do it over and over again. But those problems we've now solved. So, I'm waiting for somebody out there to say, we need to treat this disease, this constellation of diseases, in the same way that we treat cancer. We want to find out early, not late. Not because everybody needs a stent or a bypass, but because we can start treating it and we can start emphasizing all the things that need to be done to avoid heart attacks and strokes. And we just have not done that as a country yet. But I think we will. And I look forward to that moment. Yes, Ron?
I had mine done.
Did you?
Yeah, and I think it's a very good idea. It's the whole idea of treating pre-coronary artery disease, much like pre-diabetes or pre-hypertension. It's the notion of getting people involved in that right away.
Yeah. I mean, that's the whole idea. You want to know if there's something wrong. I mean, sometimes people don't want to know if there's something wrong. And, there are about 30 to 50 million Americans walking around today with silent, undiagnosed heart disease that is a threat to their life. And 40% of those people will die before the ambulance gets there. And 60% of them will get to a place like ours, and 95% of those we can fix without much damage if we get them within 2 hours. So that is a major change as well. That has been a huge advance. But that's not the best way to make the diagnosis. I think that's the tragic way to make the diagnosis. A heart attack or sudden death is not the way you want to find out if you have a problem. Any questions? Yes, ma'am.
What if you fry fish in olive oil? Is that still bad?
I think it's better, but here's what happens. When you fry something, you have to heat it to a high level. And then what happens is you can take a good fat and transform it into a bad fat. This whole thing, this concept of trans fatty acids, the reason that happens is like if you get peanuts, hydrogenated fats are in those peanuts a lot of times. And what happens is peanuts are fine and the oil was fine, but when you cooked it, then you develop a bad fat from that. So frying, anything you fry, you tend to ruin, unfortunately. Now, I grew up in a family that fried everything. We fried eggs in the morning. We had fried steak for lunch, and then dinner we had fried something else. And so if I had my choice, again, back to the feedlot animal concept, I'd mosey over to the little manger that had that. But it's not so good for us. It's better, I think, than frying it in grease. Yes?
Reversal of plaque buildup by diet.
It's very tough. It's possible. And, there's some studies that have been done that have shown that. But it takes the most austere diet. You have to live basically on a rock. and it's just hard to do. It's not impossible to do. And there are a lot of studies that have shown that, but they've kind of fallen out of favor. And the reason is that the people who got involved in those programs and who had, and the plaque reversal, a lot of them just wandered back to, normal eating. It almost takes a religious effort to do that. And here's another problem with it. Those studies have shown that a lot of those people had plaque reversal from like a 90% blockage to an 87% blockage. And me, as a plumber guy who works on these arteries all day long, that's not good enough. You know, you don't. There's not a dramatic reversal that we've seen in most studies. Yes.
What was the name of that new low-dose dosage test?
It's called Flash CT or low-dose CT scan.
I think it's up on the screen there.
I'm going to show you a picture here.
Okay.
Yeah, I don't know if you can see it, but
It might be better viewed on the, it's you can
here's
see
a
it on the
picture.
monitor.
Here's a picture of a heart. And what's that, Jenny? Is that this thing? Oh yeah, that's better. Yeah, here's your aorta. There's the aorta and the heart. And look at these arteries. You can just see them there. And the technology has improved here in quantum leaps over a couple of years. And, you know, we bought one of these machines 3 years ago, and it was like unbelievable. And then last summer, I went to look with the Siemens Corporation at this new machine, and it is beyond unbelievable because you can even see little branches. This doesn't show it very well. Even little branches of these arteries now you can see. And, you know, that would have been a miracle 10 years ago in my mind. And then this just shows different slices. We can actually look at the artery like looking down a gun barrel. And, you know, that's technology that sometimes even in the cath lab, we have a hard time doing that. Next. Was there another one, Jenny? Yeah. Oh, yeah, okay. See that? Yeah, here's an example. See that artery right there? That's a small vessel, but look at that little branch coming off here. I mean, that kind of definition, you know, we never could have done before. So I think, and this is only the beginning, really. You know, 2 years from now, we'll have to spend another several $1 million to get another machine that's a step above this one. But right now, I think that, you know, the mindset of insurance companies is not to make an early diagnosis. Because once you find a blocked artery, then what does that do? Well, then you're going to start getting treatment, you know. And then you're probably going to get a stress test somewhere along the way. You're going to get a serial test later. You may have to have a stent or a bypass operation. You're going to be on expensive drugs forever. And, you know, you may live a long time. And even that now is a liability, right? I mean, like, well, you know, more Social Security, more Medicare costs. And, you know, I mean, it's a valid concern. And so there's nobody out there beating the drum for all of us to get diagnosed quickly and live longer. I mean, unfortunately, I'm not seeing that. With cancer, it's a little easier deal because it's so frightening and so difficult to treat some of these things that the only chance you have is to make an early diagnosis. But for those 40 people who have sudden death before they get to the hospital, their chance was zero. You know, their diagnosis was made without any control on their part. Thank you all very much. I enjoyed it a lot, and thank you for coming here.